Previously, I spoke about supporting someone to manage a sickle cell crisis at home, and this was aimed at helping adult patients who have a good understanding of their pain severity and know whether they can manage at home or need to attend hospital. For younger children, this is different, of course, because they're not old enough to make a decision for themselves yet, which means as a parent, you should always err on the side of caution. However, knowing the red flags in a sickle cell crisis can make the decision between staying at home and going to hospital a lot easier. So I'm going to explain that to you now. Number one, if your child is in immense pain and that pain doesn't respond to painkillers that you have at home, then that is an immediate red flag. Try painkillers first, paracetamol, ibuprofen, maybe even weak opioids if they've been prescribed by a doctor, but if those don't work, then you need to go to hospital. Number two is fever. A child experiencing a sickle cell crisis in combination with a fever over 38 degrees C or 100.4 degrees Fahrenheit should attend hospital. And that's due to the risk of infection, triggering a more severe crisis and requiring antibiotic treatment. Number three is chest symptoms. If they're reporting any pain in the chest area, if they're experiencing severe breathlessness, then that could be a sign of developing a complication of sickle cell called acute chest syndrome, and that needs to be treated urgently in hospital. Number four is stroke symptoms. So look for these signs: drooping of one half of the face, paralysis of the arms or legs, meaning not being able to move one side of the body, and any disturbance of speech if they're old enough to speak. Any of those, call for an ambulance immediately to get straight to hospital. Number five red flag is a swollen tummy. If they have swelling in the upper left area of their tummy, then this could be an enlarged spleen, which could indicate what we call a splenic sequestration crisis, which needs treatment in the hospital. And then finally, the number six red flag is basically your sixth sense as a parent. Parents can instinctively know when there's something seriously wrong with their child, even within the context of a sickle cell crisis. So if your spidey sense is tingling, that in itself is a red flag. I hope that helps. Let me know your thoughts and experiences. Did I miss any? If you have any questions, ask them in the comments.